Okay, we are now live. Welcome everyone to PATH's Tuesday Table Talk, Patient Advocates Transforming Healthcare. I'm excited for you all to join us today. Thank you so much for making time. Our topic today is caregiving at work and home when healthcare workers are caregivers too. And I'm really delighted to have really two experts in the field of family caregiving with me today, Jerry Baumblatt and Oko Ikawami. And we're going to be just really diving in today about family caregiving and also talking specifically about when healthcare workers are also family caregivers as well. I wanted to just tell you a little bit about our speakers today. Jerry grew up actually in healthcare around her father's medical practice, so it's in her veins. She's had 20 years of experience in communication and designing communication tools, specifically around shared decision making, care for loved ones, around chronic illness, etc. She's also the co-founder of the Difference Collaborative, which brings together stakeholders to help caregivers, family caregivers work, care, and thrive, and provide them with support tools and such. And she is also a family caregiver herself, having experienced family caregiving with her father and also with her mother. So thank you, Jerry, for joining us today. Ogo is the CEO and founder of Career Haven. It is the first first caregiver career support program and communication network. She hopes it could be a resource for professionals and business owners. She started Career Haven as she struggled to balance her career and her own family caregiver needs, specifically with her sister who has Down syndrome, her grandmother, her father-in-law, and her children. So really her passion for this work came from her own experience in family caregiving as well. So I'm really happy that both of you could join us today. Just for our audience, just a few reminders. If you have any questions or comments, I would ask that you type them in our YouTube chat box. Please remember that you have to be signed into YouTube in order to do that. So we hope you all will sign in, and as we're speaking, please feel free to send those questions and comments, and hopefully we can get to some of them. And I also wanted to just level set a little bit about caregiving. It's estimated about 44 million Americans provide 37 billion hours of unpaid informal care for loved ones, whether that's a relative or a family friend. Women make up 75% of those caregivers. With the 65 plus age group expected to double by 2030, we know that caregiving is going to be something we all are going to be participating in some way or another, whether it's with a family member or a friend or a neighbor. We know there's all different types of caregiving, whether it's people who live with you or long distance caregiving, and obviously different roles you may play as a caregiver. A typical caregiver does work outside the home and provides at least 20 hours per week of caregiving. So imagine working a minimum 40-hour work week, which many of us know has become a 50 or 60-hour work week these days, and also caregiving for a loved one. We know that caregiving has substantial effects on physical and mental well-being, as well as having a huge economic impact, not only on society, but on the individual as well, in terms of loss of income, loss of productivity. And we also know, sadly, that caregiving also experiences the same health inequities and disparities that healthcare in general faces as well. So we hope to talk and touch a little bit about that topic today as well. So I'm going to stop there, and I'm going to have Jerry, please, if you could just share with us a little bit about your experience with caregiving, and if specifically today's topic, I know we wanted to focus on healthcare workers and the tremendous impact, especially now during COVID-19, for those who also caregive at home as well. And I'd love to hear your and Ogo's thoughts on that.
Yeah, no, like Ogo, I was actually working at a healthcare organization when I started caregiving. And just to be really clear, because it gets very confusing very fast when we're talking about health caregivers and family caregivers, when we say family caregivers or care partners, we're talking about people who are not getting paid or getting paid, you know, really minimal amounts sometimes from the state to care for an ill family member or friend, actually. And I think this has really shed light on what the problems are like generally for caregivers, with so many more people having to suddenly caregive, whether the person lives with you or not. How hard it is to coordinate care, to find out what's going on. With my mom's senior living environment, it has been impossible to find out, are they monitoring this? Are they gonna let us know if anybody has symptoms? Like, we know they weren't testing, but are they at least gonna let us know if somebody in the building was sick or if a few people become sick so we could come get my mom? And we were basically told, good luck, not our job. um, and you start to realize you have very little recourse. Um, and so it's, yeah, it's incredibly difficult for people not being able to go in and see a loved one already when you're trying to caregive for them. Tell people, well, here's what they're usually like, here's what their problems are like, here's things you want to be there to advocate for people, right? And that's already very hard, and this makes it that much harder. At the same time, I think that it does shed light on the fact how many people are doing this. You know, we do this now, we see into people's homes who we're working with, and we see that, oh, I have to get up and go help, you know, grandma go to the bathroom or whatever it may be. And so you start to like get a little bit of a insight into what's that like, if you're not, even if you're not doing it yourself. But I really, it took me a while to recognize, oh, it wasn't just my mom caring for my dad, I was caregiving too. And this is a big problem, is that you don't really identify with this thing called being a family caregiver or care partner. You just see it as this chaos your own family is going through. And because of that, you don't look for resources. You don't really think, even if you feel comfortable to talk about your manager, you know, talk to your manager about it. And then even if you do, you don't really necessarily feel comfortable drawing attention to the fact that maybe you're hopping out of meetings to take phone calls and always leaving early and coming late or taking unanticipated absences. And we really know that this has a huge impact on the caregiver's health. So when my mom was caring for my dad, we started to worry about her health more than my dad's health. You know, she broke her hip while caring for him. She totaled the car because she'd stay too late and drive home tired caring for him. And we just kind of saw her breaking down. And then I started realizing I wasn't doing so great. And so I really do see helping caregivers as preventive medicine. And we really said, okay, there's been a lot of surveys of people, of employees who are trying to balance work and caregiving. And we know that that's hard. But what if we look at a specific population? And we intentionally chose nurses because they're the first people their families call on if somebody's sick. Hey, you already do this professionally. Can you help grandma, or can you help mom, or can you help, you know, whoever? And we kind of knew this, but you'd think, okay, well, they're care professionals. This should be easier for them. And then you also think, oh, well, they work for a healthcare organization, which must get how difficult this is and have things in place to support them. And we kind of knew those things aren't true, that even when you're trained caregiver professional, dealing with the family dynamics, dealing with the social dynamics of trying to talk to your loved one's doctors, dealing with just, I mean, maybe you're an OB nurse and now you're caring for somebody with heart failure. You don't have training in that. So there's all these challenges still. Even nurses, when we surveyed them, said they wanted more training in certain types of hands-on care for the person they were caring for. And then, you know, to top it all off, they feel extra guilty that they're not doing a perfect job of this because they really feel like their family expects it of them. And then to make it maybe that much worse, they're having an experience that I was having, which is this ironic experience of working in healthcare and like come in and do things that help other people, take care of other people's families, but like kind of good luck with your own family. And yes, we give people time off, but we keep thinking that if we just give them a little bit of time off when there's an acute or a serious situation, that we did what needed to be done. And what we don't think about is caregiving on average lasts like 5 to even 10 years if somebody has dementia. So we are just not planning for the long haul, and caregivers themselves don't really realize what they're in for in terms of having to take care of themselves or having to take care of a loved one. So that's where we really dug in and said, well, let's look at nurses particularly. And so we surveyed 200 nurses who are family caregivers. And then we also surveyed about 55 nurse managers and leaders in hospital and healthcare environments. And we really found a lot of interesting information. But I think I'm going to stop there so that Ogo can kind of start to give a little bit more on her background, and then we can circle back.
Thanks, Jerry. So my name is Ogo Kweme. I am CEO and founder of Career Haven. Our focus is helping employed caregivers stay employed. So we're looking at the economic impact of caregiving. So many, myself included, when we're met with the challenges of caring for a sick loved one. For me, I'm caring for my sister with Down syndrome. So caregiving for me started way before I even knew what the term caregiving is. And then into my grandmother, and now into my father-in-law, and then working a full-time job. I'm a healthcare strategist. And so in the consulting world, you know, you've got this fast-paced environment, you've got client deadlines, you've got things to meet, you've got expectations to fulfill, but then you've got these loved ones that are dependent on you and waiting for you to be that go-to. And it became too much. And I actually stepped away from work for a little bit. First, I tried the reduced hours strategy, which a lot of people try. And then I realized that it's still too much. And I didn't, not saying that anything was wrong with my employer. It's just, as a caregiver, you feel alone. Like to Jerry's point, you feel like you're the only one going through it. No one talks about the ugliness of caring for another family member. So you don't feel as open. You don't feel like you can ask a coworker to fill in for you. Or maybe you do ask the first time, but then do you keep asking the second, the third, the fifth, the seventh, the 15th time? It starts to dawn on you that you're weighing the team down. And I literally was telling myself that I'm weighing my teammates down. And so you stop talking, you start recluding into your own world, and you think, you know what, let me just leave, focus on caring, and come back. But once you leave, that decision alone has a ripple effect, a financial ripple effect that so many caregivers fail to think about. And so when I was going through that, I thought to myself, you know what, there are a lot of geriatric care managers, pediatricians, there's a lot of medical providers that help us on the care end, but I really wish there was someone at work with me, helping me to balance it all, helping me to stay focused, helping me to be energized, helping me to prioritize myself. And so that's why I started Career Haven, where we're looking to protect the economic security of working caregivers. And I come from healthcare. I work with clinicians all the time. I know the healthcare space. And to me, it's like getting hit with a double whammy. You're a clinician, you're a healthcare provider, you're a health administrator, and you're caring for the lives of other people. But what is the system doing for you? It almost feels like you're left alone at the end of it. And so I felt like, that's the area we want to tackle first. We eventually want to get to all other high stress industries, but healthcare is my domain. It's where I've lived, breathed. And so I felt like, you start at home. Let's improve the working conditions for our healthcare providers who double as family caregivers. And so we do a lot of work on the employer end. So talking with the employers, instituting training programs for managers, helping them to understand the dual nature of caring in the workplace and caring at home. What does that do for your psyche? What does that do for your mental health? And COVID-19 has really highlighted that. Having to do that pivot, and you being the one your family goes to for healthcare advice, and who's caring for you, who's thinking about your well-being. We ask for the healthcare providers to meet quotas, to do all the documentation. There's a lot around clinician burnout, but how are we addressing caregiving from that standpoint as well? And I found that there's not a lot being done, and I'm really trying to push the needle on that. And one of the biggest things that we're working on right now is actually using analytics to help predict burnout points prior to, especially for clinicians who double as caregivers, and then using that data to operationalize the healthcare business as a whole. How do we structure our initiatives? How do we pre-plan? How do we add in buffers? Because in the work I'm doing and how we see it is, as we get closer to that doubling point for seniors over 65, our healthcare system is going to be strained on both ends. The patients coming in the door and our professionals who are caring for their own parents as well. So we're going to have that dual strain, and I believe we have to get to a point where we can actually embed buffers, build culture, and start to look at 5 years from now, 10 years from now, how do we keep operations going, knowing that our staff are going to need enough time to care for their parents and their patients? How do we build a culture that supports that and makes, in my word, in my phrase, or sort of celebrates that and makes it comfortable for us to talk about it, because this is a phenomenon that if it's not touching you right now, it eventually will.
Thank you, guys. So I'm glad you touch upon that point of culture, Ogo, because I think that in healthcare, whether we're talking about patient-family engagement or looking at caregiving or making sure that, you know, patients and families feel part of the care team, and are we supporting our healthcare workers? All of it goes back to culture, right? How do we shift and change and reimagine the culture that's been there for so long in healthcare? And I think part of that culture is that culture of silence, and, you know, not speaking up when you don't feel perhaps you have a safe space to say, hey, I need help, I'm struggling, or I may have made a mistake because I'm struggling. And one of the questions that came through in the chat was, you know, do employees trust going to their employers for help? Is this an obstacle in your work? And I think, you know, that speaks to that culture piece. And I think more so, you know, whether you come from communities of color and minority communities, there's that added, you know, level of mistrust and the health inequities and the societal inequities that, you know, are part of this. So I thought I would love to hear you guys speak to those points, and, you know, how do we build that culture of creating a safe space and bringing down those barriers of inequities as well.
Yeah, that's actually the whole focus of what we're trying to do with the Difference Collaborative, is really create a culture of care in the workplace, which would mean a better working environment for everybody, right? Not just caregivers. And part of that is awareness raising, like, so people themselves don't realize they're caregiving, and then people don't really understand what their colleagues are going through who are caregiving. So it's hard to empathize, because and we explicitly asked nurses this question about if they were, how comfortable they felt talking with their manager about caregiving. And it's a really fascinating situation, because part of culture isn't just, you know, training the managers and telling people to do things. The leadership has to lead by example. And they have to, like, show that they take leave to care for family members. They have to show that it's actually okay, because, for example, one of the comments that we got, well, and by the way, people said something like 30% about were not comfortable talking to their manager. So that's 1 in 3. And then this is the type of comment we got even when people said they were very comfortable, is they would say things like, the leadership has always expressed concern over, like, my partner's health and supported me 100%, but I still didn't really feel like it was okay to take this much time off. And then, by the way, you know, a lot of people are not eligible even for FMLA. We heard one nurse talk about how she was 4 hours short to qualify for FMLA to take care of her father, who was terminal, and she couldn't get FMLA approved to take time off. And she says, I was fortunate that he passed away on my day off and I could be with him, you know? And so you start to see this, like, breakdown. And then on top of it, the nurses feel really bad that they're that their teams have to cover for them. And by the way, that's not sustainable as more and more people caregive. And a lot of teams do great things and like cover for each other and help with babysitters and cover shifts and everything they can do. But as more and more people need to take time off for caregiving, like that's not going to be, you know, something that we can continue to grow. Like people donate PTO, but if everybody needs their PTO, nobody can donate PTO anymore. And then on top of it, FMLA is paid time off. And then in addition, and I think this really gets to all different cultures, whether you're gay or Black or whatever it might be, is that increasingly we're taking care of people who are not part of what's defined as FMLA as a family member, an aunt who raised you, or, you know, a cousin who you're good friends with, or a boyfriend. You know, it's like these things don't fit into FMLA. And so places have a hard time even complying with that correctly. And there are states that have been trying to grow the definition of who qualifies for FMLA, but we really advocate just for more broader leave policies. And then to Ogo's point, you can't just give people leave. You need to help them as much as you can. Otherwise, you can take a lot of time off, but if all you're doing is running around like a crazy person trying to figure out our impossible, I don't even want to call it a system anymore, fragmented mess, like you're just going to come back totally exhausted and burned out. And burnout is one of the things that we heard about. And what's interesting is managers and leadership think that staffing problems, nurse burnout, and team dynamics, and even quality of care delivery, they think those are bigger problems than even the nurses themselves think they are. And yet they're just kind of like, but what do we do? So like we really have to think differently about this. And that's where I think we really need to co-design with leadership and with employees, like what does this look like? And how are we going to normalize this and destigmatize it and make it okay? Because people are quitting their jobs. They're sometimes being, you know, penalized for this. And other people are just going part-time or dropping out of the workforce altogether. And we're creating a larger number of people who are going to fall into poverty because of it.
I agree with you, Jerry. I echo literally everything you just said. And when I'm working with employers, the one thing we look at is what are your utilization rates for your employer assistance programs? That speaks volumes as far as how the culture of that organization is structured. If employees don't see that as a trusted resource, and I'm emphasizing trusted because a lot of the people we're talking to feel that it's there, but it's not really there. It's not really for me. It's more of a, oh, if you use it, now they know you're not as committed or you've got issues. You're going to be that team member. Whereas an employer assistance program serves as that liaison to help get those resources to the staff. But if the staff don't actually trust it, let alone know about it, that's a big problem. So there's a lot of educating within the organization, educating managers on how to step up and speak. We all want to be cognizant and cautious of how we talk to our employees, but then at the same time, what are we saying when we do talk to them? Are we being empathetic? And are we just saying, for example, I will use myself as an example. When my father-in-law had his spinal surgery and I was driving 4 or 5 hours back and forth from Virginia Beach just to be with him and then come back to meet with clients, my manager told me, oh, we've got an employer assistance line. You should call that. Well, what are they going to do for me? Am I supposed to call and explore? I really don't have time for that. I need to get work done. I thought going to you, you'd give me some answers. I got a phone line to call and hopefully get the answer I'm needing. So we're kind of pushing employees off and thinking that they'll figure it out when really, as a manager, and I'm having to do that myself with the number of teams I'm managing, you're that liaison. You're that point of contact, and your knowledge base makes a huge difference. And that's why we really emphasize training our managers to understand what does caregiving look like? How does it impact productivity? This isn't a short-term thing. This isn't something that happens for a day or two, or maybe 2 weeks. This is something your employees are going to deal with for years on end. And it's going to impact your projects, it's going to impact your initiatives. And on the clinical realm, it's going to impact patient care. We haven't even started the mental health discussion yet. How does the mental health of our clinicians get impacted by caregiving? That double layer. Imagine you're a surgeon. You're supposed to be focused, totally committed to this patient in front of you, but you've got a parent who's at risk for falling. They're at home. You're unsure if the nursing assistant that you hired has actually gotten there. Have they taken their medications? Now you see your mind is drifting. You're not as focused. You're not as, and then you lead into the medical errors and things like that. And so there's this whole slew of downstream impacts when it starts with establishing a culture where we understand what each other is going through. We don't ignore it. I think in the past, we've had a culture where work is outside and home is outside, work is here. Leave your problems at the door. I remember someone used to tell me that. In this day and age, that's false. It's impossible to do. You can't leave your problems at the door. Your problems will float with you. They will meet you at your desk. And if you don't address it, it leads to burnout. It leads to mental exhaustion. It leads to depression. It leads to isolation. And we all know those are the tell-all signs of bad health. Then someone who's ignoring their own health, not going to the doctor, focused on all these things. So it's really a huge hole of issues when we don't address it and we don't talk about it at work and we don't make it everyone feel comfortable when it comes to this.
Thank you, guys. We had another question come in, and I mean, you guys alluded to it a little bit, but what specifically could employers do to change the culture to increase, EAP program utilization? What are some strategies that you've both seen in your work that have really helped facilitate that? If you want to maybe take the last couple minutes to
Yeah, well, I'll talk really briefly about an initiative we were about to start right when COVID hit the hospitals with nurses in particular, but I think similar things could be done in other workplaces as well, is that we were going to say, hey, just start by asking your nurses when they come back from caregiving or when a significant experience in caregiving happens, what was it like to be on the other side of the bed? And how could we serve our family members better? Because it's a great way to honor their experience, destigmatize it and make it okay to talk about it, recognize that they were, not on vacation, that they were doing some really hard work, and that there's meaningful information in there that they can bring, because a lot of the nurses explain that they came back and they dealt with family members differently. They tried to prepare them better. They really tried to do that. And that's a great way to socialize it, help other team members hear about what people are going through, but in a way that we're talking about it kind of like, here's your experience, but how are we going to learn from it in what we do? And so it's a really lovely way, I think, to kind of just start to socialize. This is what's happening. These are the experiences people are having. And how are we going to plan better for this, I think, is the next question on our teams. But start with, what can we learn from your experience being on the other side of the bed? And I think that that's a great way to just start. And then from there, we really need to have more of those conversations around culture and actually truly co-design that. Like, the employees actually have a lot of great ideas, but we need to talk to them, and we need to not say things like, well, it's impossible to staff up. It's like, well, is it? Because at some point you're gonna pass some threshold where it's more expensive to bring in registry nurses and deal with all the chaos that's caused by people taking leave and all the patient safety and quality that impacts as well. So I think we just need to start being more open to how we're going to think about addressing these things.
That's a great question. And Jerry, thank you for that. From my perspective, I think discussion is a big piece. I found that during morning huddles, maybe if it's just 5 minutes at the beginning of a leadership meeting, just calling attention to some of these issues as they come up, not just sweeping it under the rug. I think we do a great job of sweeping issues under the rug as human beings in general. But if we just let ourselves be vulnerable and admit we have no idea how to address this, help us help you. And in that discussion, employees see that you're invested in their well-being. You care about their family. It isn't just about meeting quota. It's about our well-being. And something that initiative that we're working on right now is we're actually trying to pilot technology that will help employers sort of a glimpse into the mental state of their employees. Are they overburdened? Are they stressed out? Are they not sleeping? Are they feeling a little bit more isolated? Is the care of their individual, depending on the condition, impacting their work? And from there, being able to now see on a departmental level or a organization level, where are those pain points coming from? And do we have programs to address it? Do we need more morale building from middle management or from executive manage on down? And for us, we feel like if we are able to break the barriers of communication, I think the biggest piece that we've been emphasizing this entire time is communication, talking, indicating where those burden points are, and then being able to deploy appropriate resources when necessary. And then I can talk about all day about analytics and how we can start predicting some of these things once we have the data. And Jerry, I'm sure you know, once the data speaks, we have a better glimpse as far as what the strategy will be and what we need to do.
Yeah, and we also did survey nurses about what types of things they'd like to see that would help support them as family caregivers. And one of the top things they said was they basically wanted care coordination services. And then a lot of them wanted hands-on training for things that they didn't know how to do. And then a lot of it was just different types of support. Of course, things like paid leave would be amazing. A lot of times they just want to know that they're not leaving their teams in a lurch and that they're going to have a job when they come back. Or that they have a job if they have to keep taking off. And we actually have in-flight research right now too, where we're now asking healthcare and hospital leaders and nurse managers and nurse leaders, like, what is it that you are willing to try and do? Like, here's some of the many things that we've heard, and score them in terms of what you're willing to try, what would be feasible to try. And again, I think this will all be informed as an increasing number of people in leadership have these experiences too. In fact, the people who had their own caregiving experiences as managers or leaders were more likely to take our survey, which didn't surprise us. Like, you have that empathy as to why this is such a serious problem. So if you're at an organization, just go to Difference Collaborative and look on our research page, and you can click through to the current survey for nurse leaders, nurse managers, and HR directors.
Well, thank you guys both. I know we could spend hours and hours continuing our discussion, but unfortunately we're at time. But I do hope that we could maybe have you guys back and continue this conversation, because I know there's many layers and we haven't even scratched the surface today. But I appreciate all the work you both are doing and the strategies that you've shared. And again, communication is key. In all of this work, communication is key, and compassion and empathy has to be part of that communication. So hopefully our audience is able to take some of this away to their organizations. Thank you all for joining us today for the PATH, Patient Advocates Transforming Healthcare Tuesday Table Talk. We hope to see you guys next week. Same time, same station. And for more information about the Difference Collaborative and the survey that Jerry referenced, please visit my LinkedIn page, which many of you use to access the PATH's work and our table talk. It's all there. And we look forward to seeing you all next week. For Jerry and Ogo, please stand by for a few seconds while we make sure the YouTube live stream has closed, and I will let you know when that is complete. Thank you all. Have a good day.